Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's experts will discuss efforts to reduce lead and forever chemicals in drinking water and their public health impact. I'd like to briefly introduce our speakers. Natalie Exum is an assistant scientist in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Carsten Prasse is an assistant professor in the Department of Environmental Health and Engineering at the Johns Hopkins Whiting School of Engineering. We will have time for questions following our speakers' remarks. We will take some that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to all panelists and hosts. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing, and it will be recorded. Dr. Exum, please go ahead.
So what brings us here today is that in late 2023, the Environmental Protection Agency announced a proposal to strengthen its lead and copper rule that would require water systems to replace lead service lines within 10 years, helping to secure safe drinking water for communities across the country. Lead exposure disproportionately affects low-income communities and communities in color, due in part to decades of inequitable drinking water infrastructure development and underinvestment in these communities. The Flint water crisis in 2014 was a national wake-up call that communities in America are still living with the legacy of lead pipes and their toxic neurological effects. The tragedy in Flint was caused by a cost-cutting measure by the city government that switched the source water from the Detroit-supplied Lake Huron water to the much more polluted Flint River. This underscores how fragile our drinking water systems are to disruptions and how lead pipes in the ground can be hidden dangers. Flint officials failed to treat the highly corrosive Flint water, which precipitated lead leaching out into the aging pipes in thousands of homes. And adequate corrosion control can be effective to minimize the risk of lead leaching out of pipes into drinking water, though a disruption to the water chemistry can make adequate corrosion control a challenge. So even with adequate corrosion control in drinking water, when water sits in lead pipes, especially overnight, lead leaches into the water, going undetected when the tap is turned on. Replacing lead pipes, especially lead service lines, is the only way to eliminate the risk of lead leaching into drinking water. And after service lines are replaced, the other potential sources of lead in drinking water include pipes that are constructed of lead, solder, and faucets. Lead pipes were commonly used in the early 1900s in America for its malleability and durability, and it was not until 1986 that its use was banned by Congress. So older homes built before 1950 are more likely to have lead pipes, making older post-industrial cities a higher risk for lead in drinking water. The Environmental Protection Agency estimates that there are 9.2 million lead service lines that are still in use across America. And over the next 10 years, all 9.2 million lead service lines will be required to be replaced under the EPA's proposed lead and copper rule improvements. The first step towards replacement is identification of where these lead service lines exist within every water utilities system. And a lot of utilities do not know where the lead lines lie. Part of EPA's proposed lead and copper rule improvements require water utilities to complete comprehensive lead service line inventories and make them available to the public. These lines cross from the public over to the private side of the property line, leaving the burden on residents often to identify where their pipe materials are made of. This brings with it a lot of confusion to locate the correct pipe in one's basement and correctly classify it as copper, lead, galvanized, PVC. When a community has unreliable records of what these service lines are made of, the materials are often marked as unknown, and residents are often asked to evaluate their pipe materials with a visual inspection, often called a scratch test. Identification of lead service lines improves when that visual inspection is paired with water testing of flush water samples and sequential water samples. So if you suspect that your home has lead pipes, especially if it's an older home, consider testing them. You can request a water report or reach out to plumbing professionals or for inspections. And if you do find that your water service line is made of lead, don't panic. The following actions can be taken to reduce lead. First, run your water to flush the pipes. The longer water sits in plumbing, the more lead it can contain. So if a tap has been unused for several hours, flush the water before using it for drinking or cooking. Flushing means running the cold water for about 5 minutes before drinking. Second, clean your aerators. The aerators or the screens on your faucet should be cleaned periodically every 3 to 6 months and if you're following a lead service replacement, do it every month for 6 months, and aerators should be replaced when they're damaged. Third, only use cold water for cooking, drinking, and especially for preparing baby formula. If you need hot water, you can draw the cold water from the tap and after running it and then heat it up. Hot tap water can dissolve lead into the pipes and make it more easily to have higher lead levels. But remember, boiling water does not remove lead or reduce lead at all. Third, filter your water. For drinking, cooking, and making baby formula, use water that's been run through a filter. Filters should be certified by an American National Standards Institute, like the NSF 53 for lead removal and the NSF 42 for particle removal. And maintain those filter devices in accordance with the manufacturer's instructions to protect the water quality. And last, identify and replace plumbing fixtures in your home that contain lead. So fixtures such as faucets and taps that were installed prior to 2014 can even contain up to 8% of lead. And there are new standards in place now that require that to be below 0.25% for drinking water fixtures. So in conclusion, lead in drinking water is a health hazard that has gone on in America, especially in low-income communities and communities of color, for far too long. There are once-in-a-lifetime investments and regulations going forward now in EPA's proposed lead and copper rule improvements that will ensure every child and family can turn on their taps and without fear take a sip of safe and clean drinking water. Thank you.
Thank you, Dr. Exum. Now we will hear from Dr. Prasse. Dr. Prasse, please go ahead.
An estimated 98% of the US population have detectable concentrations of per and polyfluoroalkyl substances, or PFAS, in their blood. To address the issue of PFAS that you might also have heard of as forever chemicals, EPA has recently proposed to categorize 9 of these compounds as hazardous. But before going into the details that led to the decision, I want to first talk a bit about what PFAS are, why they are in our drinking water, and also why we are concerned about them. PFAS have already been used for several decades in numerous applications, and they are parts of many items that we use in our daily lives, in our households, for example. When you just think about non-stick cookware, water-repellent clothing, stain and resistant carpets and upholstery, as well as food packaging. In addition, they have also been used in firefighting foams, which has led to elevated exposures of firefighters. The main reason why they are used so widely and why they are commonly or also produced in high amounts is that they're very stable to thermal and chemical degradation, as well as their stain and water resistancy. And the issue with this benefit in terms of their use, though, is that the same attributes also make them very resistant to degradation in our treatment systems when you think about wastewater treatment or drinking water treatment, but also in the environment. And this fact has led to the term forever chemicals, how they are commonly referred to today. If you wonder how they get into our drinking water, there are a number of different pathways. First of all, as already mentioned, we're using them in our households and are potentially flushing them down the drain. And then if they're not removed in our wastewater treatment plants, they get into our rivers, in our streams, and also in our groundwater, which are all commonly used for our drinking water production. Another important source of PFAS are also airports and military sites where these firefighting foams have been used, as well as industrial facilities where the PFAS compounds themselves were produced. And all this has led to a contamination, at least of what we know today, of around 50% of our rivers and streams that contain measurable PFAS concentrations. The main reason for the proposed categorization, or the step that EPA is taking to categorize these as toxic, is that there's also increasing evidence that there are toxic effects on a variety of levels. In order for EPA to categorize these compounds as hazardous under the Resource Conservation Recovery Act, the compounds might be or have to be either toxic, cause cancer, lead to changes in the DNA, which can lead to cancer, or produce effects in the human embryo or fetus. And in the case of PFAS, unfortunately, several of these criteria are met. So we know today that even very low concentrations can lead to impacts on the reproductive system, developmental effects, increased risk of certain cancers, reduced immune response, as well as increased cholesterol levels. And one reason why EPA is taking this step is also to make it easier for the agency to actually take action in terms of cleaning up contaminated sites, but also providing funds to treat our drinking water accordingly. But one aspect to consider, or that is really important to highlight, is that these 9 compounds that are potentially or that are under consideration for being categorized as hazardous are really only the tip of the iceberg. Estimates today are that there's more than 12,000 individual PFAS compounds. And unfortunately, for most of them, we have basically no understanding about their toxicity, and also we don't really know a lot about their occurrence in the environment. And so as such, this categorization of these 9 compounds might only be the beginning, and we will have to see in the future if there are other compounds that are included into this class. But because of the large number of compounds, there's also more and more proposals to, instead of categorizing them as individual compounds, to actually categorize them in as a class. But we will have to see, and this is still under discussion, so we have to see where this process is going. But overall, I really want to highlight that PFAS are very widely common in our drinking water sources. And we still only know very little about the impacts that these chemicals have. And I think the step by EPA is really urgently needed to protect our drinking water and ultimately our health. Thank you very much.
Thank you, Dr. Prasse. Now we will take questions. If you have a question, a reminder, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. The first question is from Tolly Taylor at WBAL TV for Dr. Prasse. Where are PFAS levels in tap water disclosed, and how often are those websites updated?
So it varies pretty widely. So there isn't one common homepage, so to say, where you can find this. There are some utilities who are disclosing this information on their drinking water reports. There are also certain states who have homepages, but there isn't at this point one common source. So I can't really comment on how often these are updated. But there's a lot of work going on right now in the PFAS direction. So I'm very positive that in the future there will be more and more information available about the presence of these compounds in drinking water.
Great, thank you so much. Here is a question for you, Dr. Exum, from Pian Huang at NPR. How are water systems mapping their lead pipes? Are they looking at old charts, digging holes so they can make visual inspections? How will they be made publicly available?
So pipe identification is the most critical first step towards replacement. And often where utilities go first are paper maps, maybe in boxes down in the basement. And that really is where you have to start, because lead lines could have been replaced with copper in the 80s. And, there's a new homeowner, and that new homeowner doesn't know the answers to those questions. So oftentimes utilities start within their own house where their records begin, but it's often a partnership between the utility and the resident to figure this out. So that's why residents are often asked to do inspections of their own home first, and then report that to the utility, often through pictures or just from descriptions to ensure that they're looking at their correct pipe. But oftentimes they will mark it as unverified, and then until the pipe can be verified potentially by someone at the utility or professional, if there is a question mark about the record or about the reporting from the resident, it's not verified non-lead until that point. And so it really is an iterative process that first begins with what the utility knows about their pipes and their service lines. We're really talking about service lines here. These big water mains are not the concern here. It's when the water slows down and it goes off the main into the home where we're very concerned about those lead exposures. So it is an iterative process, and it's not quick. It can take many years to get a full and comprehensive view of what your service lines are made of.
Great, thank you. Here's a question from Claire Bugas at Very Well Health for Dr. Prasse. PFAS are notoriously hard to scrub from the body as well as the environment. A new small study indicates that the cholesterol drug cholestyramine can reduce PFAS blood levels by 63%. How useful or feasible may it be to develop methods for decreasing individuals' PFAS blood levels as compared to scrubbing waterways and preventing environmental contamination?
Well, I would certainly say that the cleaning up of the waterways, or especially making sure that our drinking water facilities are equipped to remove these compounds, is the way to go. I mean, with the use of chemicals in our body, I certainly have some concerns. I mean, there are side effects. Every chemical that we take has side effects. There might be certain conditions that prevent certain people from taking medicine. I think it might also be a cost aspect, who can afford these compounds. So in my opinion, the way to go is really thinking about drinking water treatment and removing them, in addition to really efforts to stop that these chemicals actually get into the environment.
Great, thank you. Here's a question for Dr. Exum. Is it feasible for all lead pipe service lines to be replaced in the next 10 years? Who will be coordinating, paying for it?
So feasibility depends on everyone's urgency. And what I mean by that is this is a whole of community effort to accelerate pipe identification and pipe replacement. I would say that the $15 billion allocated under the bipartisan infrastructure law is a good start to really give a shot in the arm to this effort, though money is going to be a limiting factor here. And the EPA has also said that 50% of the money going into the state revolving funds for water, which is ultimately how this federal funds trickle down to communities, that 49% of those funds need to go to disadvantaged communities. And so for that to happen, it's not just, it's a whole of community effort for utilities to do the outreach and to secure the contractors who are going to be the ones who can dig up the ground after these pipes are identified. But I would say 10 years is a very tight time frame to do all of this, and why an all hands on deck effort needs to be made from elected officials to community organizers to the utility itself as well. So I'm concerned that the timeline is fast, but that it can be done if there is urgency around this matter.
Great, thank you. Here's a question from Michael Phyllis at the Associated Press for Dr. Prasse. The EPA assumes that only a fraction of a person's PFAS consumption will come from drinking water. How would you explain the level of protection the PFAS water rule will provide to people considering there are so many other sources?
I mean, it's a great point. I mean, as I illustrated a bit, there's many other potential sources. I mean, the household chemicals or the household products that we use that contain PFAS, potentially also food packaging. So I think the level of protection that the drinking water rule would provide really is depending on a lot of different factors, including where do you live? I mean, do you live in an area that has very high PFAS concentrations in the drinking water, for example, as a result of, for example, the chemical manufacturing of these compounds or the other uses of these compounds? I mean, food is another potential source. Unfortunately, PFAS is also present in biosalts, which are used as agricultural fertilizer. And there are some examples in Maine where whole farms had to shut down because of high PFAS levels in the soil and potentially also in the produce that was grown on these farms. So it really depends on, I guess, your individual behavior. I certainly think that the protecting drinking water is one step, but it's certainly not the only one. And as I mentioned in my previous comment, I think really making sure that these compounds aren't emitted into the environment anymore is, in my opinion, the most important aspect. But again, drinking water contributes, and I think for that reason, it is important to take measures there.
Great. And having said that, just following on to this, Dr. Prasse, what can individuals do to avoid PFAS? Should we test our tap water?
Yes, I mean, so there are a variety of different things. I mean, I can maybe talk from my own experience. I'm not using any nonstick cookware anymore. I'm also avoiding food packaging that might contain. I mean, unfortunately, if you're getting a lot of takeout food, a lot of this food packaging contains PFAS. And then the other aspect you can also do is you can actually filter your water at the tap. There are filters now available, basically pitchers that are certified. One thing I want to mention or definitely highlight there, make sure that they are certified for PFAS. And there's information available about this online. Not all filters are capable of doing or of removing PFAS, but there are certainly ones. So yeah.
Great, thank you. And for you, Dr. Exum, should people be tested for lead exposure on a more regular basis, specifically children?
Yeah, so an important point here is that we as a population only really know if our children are being exposed to lead in their environment when they're at about 1 year old, when basically insurance has decided that's the right time when they're 1 year old to get a prick of, you know, the heel or the finger, and to get a lead sample there at the age of 1. What that means is your child starts really crawling around and licking the ground and, you know, drinking formula much earlier than 1 year old. And we know that the blood-brain barrier is less developed the younger that they are. And so there's a real hazardous time for a young child to be exposed to lead in drinking water, especially through formula and drinking, you know, tap water that goes undetected. And so, you know, between the ages of 1 and 2 are when we really begin to look into the child's body to know, but I would argue that that's almost too late. And so I think that to be more proactive, especially in our communities of color and low income communities, potentially moving that age limit down, or even ensuring that even by 1 year old that you are making sure that everyone's getting tested, because a lot of these communities are not getting, you know, we don't have enough compliance with that 1 year old requirement. So that is my greatest concern, that we are missing children, or rather detecting it when they've already been exposed and the neurological toxic effects are already taken on. But again, you know, right now is when for young children is really where we know it's the everyone in the population is getting tested.
Great, thank you. For you, Dr. Prasse, Tully Taylor at WBAL-TV. From what I understand, the EPA's proposed highest level allowed for PFAS is 4 parts per trillion. Local water utilities in Baltimore report detecting PFAS, but at levels below 4 parts per trillion. How dangerous, concerning is that?
I mean, that's a difficult question to answer at this point. I mean, I think one thing really to keep in mind is that we still know very little about what the health impacts are, especially on a population level, because these compounds just haven't been around. I mean, they have been around for a while, but the research hasn't been done research done for long enough to really answer that question. I would say, yeah, we wanna have as low levels as possible, and again, there should be efforts to remove that. But at this point, it's just very hard to say at these levels if it is concerning or not. I mean, I think it is concerning, but we don't really know what the implications of these concentrations are, unfortunately. And I think that's why we really need. There's much more research needed, and I think also these steps that EPA has taken are really needed to kind of tackle this problem.
Great, thank you. And just a reminder, if you have a question, please enter it in the Zoom chat addressed to panelists and host, and enter your name, media outlet, and question. For you, Dr. Prasse, are there other sources of PFAS exposure beyond water? You've mentioned several of these, but just to get clear on those.
Yeah, so as I mentioned, food could potentially one, depending on if, for example, produce was grown on fields that is contaminated with PFAS. Food packaging, unfortunately, is a concern when you think about. I mean, think about pizza boxes that are basically where the grease doesn't get into the cardboard. I mean, the reason that this is not happening is that they are coated with a material that can contain PFAS. So these are the main things. In addition, then also to the things we use in our households that I mentioned, when you think about your water repellent jackets or the stain resistant sofa that you're sitting on.
Great. And can you speak to whether blood testing would work for those who may have potential high exposure to these compounds?
I think it is valuable to, especially for people that have potential high exposures, because it allows them at least to then, for example, talk to the medical professionals to think about follow-up examinations to really monitor potential health effects. But again, coming back to what I said, the issue really is that we don't really know what levels are at this point, what levels are concerning or lead to health effects and which don't. So that's something that only the future will tell, basically, or we will be able to answer in the future what levels are actually leading to certain effects.
Great, thank you. So that ends the Q&A, but I'd like to welcome both of you to offer any final comments. Dr. Exum, please go ahead.
So lead in our population is a great concern. Unlike PFAS, we know a lot about lead and how it can harm our bodies and have lifetime effects for children as they grow into adults and lower IQs and have lots of developmental impacts. And so this is one contaminant of drinking water that we are sure of. And so since we are so sure of its toxicological effects, we should be making every effort to get it out of our drinking water and all of the other sources that it can come from in our environments. And a whole of government approach is needed. And I'm optimistic that the recent attention that it's gotten from the EPA is going to make an impact in a positive way for our future generations.
Great, Dr. Prasse. And we do have another question, but please go ahead and make your comment, Dr. Prasse.
Yeah, I would just reiterate again that I think the step that EPA is taking is certainly a one that is in the right direction. It will hopefully lead to more research to address the presence of these compounds in the environment, but also to more efforts to really elucidate kind of the health impacts of these chemicals. But I think it is important to consider that this is can only be the tip of the iceberg, and that there's really much more work needed to deal with this issue.
Great. And we do have a final follow-up from PN from NPR for you, Dr. Prasse, on PFAS exposure. Is it most concerning when it's ingested through food and drinking water? Is being exposed through clothing or furniture as damaging?
Well, so I mean, it's a complicated question in a sense, because it depends on different PFAS are likely to be present in, for example, like food and drinking water is certainly an aspect, but it might be other PFAS that you are inhaling, for example. So when you think about things that are used in your furniture, these compounds might get from the furniture, migrate into dust, so you might inhale the dust. There are also some compounds that are present in the air. So I would say at this point, all exposures are concerning, and I don't think we know enough to really say which exposure pathway is the most problematic one. But based on what we know today, especially in communities where we know that they have high concentrations in drinking water, I would say for those, certainly drinking water is likely to be the most critical one at this point.
Great. Okay. Thank you both for your presentations and insightful answers. And to the participants, we will email the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.